Hi, I'm Dr. Ron Miller of CashBasedPhysiotherapy.org, and today we're going to go over a really important concept. I read this in a book, and this concept goes into so many details and so deep that we can spend some time to go over it, but I'm going to read this right now, and then we'll kind of step back and think about it. So, rich people choose to get paid based on results. Poor people choose to get paid based on time. So, what does this mean? And us as entrepreneurs and small business owners in a cash-based physical therapy setting, we need to start thinking about this. And you can take concepts from past lectures or what I discussed about your circle of influence and who you're hanging around with, but we need to start modeling successful people. We need to start modeling CEOs and interviewing them, and why are they successful? What strategies can we take and apply to physiotherapy to make sure that we become successful? Really, create true value in healthcare and to the public. So, again, going off of this, poor people choose to get paid based on time. So let's go into some examples. If you go back to standard care, which we've all been in, and we've worked at an hourly rate, that's not fun. You're choosing to get paid based on your time. So whether it's $45 an hour, whether it's $28 an hour, whether it's $65 an hour, you're getting paid based on time. And the problem with that is that you have to see more patients to get paid more, or more, you have to work more to get paid more. That's a problem because you're going to get capped out. There's only so many patients that you can see a day. There's only so many hours a day that you can actually work. So at some point you're going to reach and be fully plateaued, and you're going to be overworked and underpaid for the amount of value that you bring. Okay? And we've all been through this. That's what standard healthcare is. You're getting paid an X amount per time that you're treating, and now your businesses in standard care are trying to take advantage of that because they're bumping up productivity standards, and now you're seeing 3 patients per hour or 4 patients per hour because they want more money coming in per hour, but they're only going to pay you X amount of dollars per hour to work. So at some point you're going to plateau and only make so much money because you can only see so many patients a day and work so many hours, okay? But going back to that saying, that's what poor people do, or that's what unsuccessful people, that's the type of habit that they think about. So, as you're starting out your cash-based physiotherapy clinic, are you doing that same principle in your cash-based physiotherapy setting? Are you only getting paid X amount of dollars per time that you do? So I challenge you to think outside the box and get out of your comfort zone. Can you create a system that will get you paid based on your results? Or are you still doing that same old strategy that unsuccessful people do and get paid based on time with small goals, small revenue, small income, just because that's your comfort zone or that's all that you know? So people ask me a lot, why do I have treatment packages? Rich people choose to get paid based on results. The treatment package in a cash-based physiotherapy setting will allow you to get past that getting paid based on time. That you're going to get paid based on your result, on your patient experience. And this tends to be more of the complex cases that no one else can solve, or the patients that have failed multiple treatment approaches. They're going to come to you because you're the best and you can solve their problem. So Elon Musk said this best, and I apologize if I messed this up, that you get paid in direct proportion to the difficulty of the problem that you solve. So if you're starting out and you're just trying to make ends meet, there's no problem with starting out with just individual rates getting paid based off of time. But if you want to get to that next level and thrive and succeed and overcome plateaus, you're going to have to choose to get paid based off of your results. And thus the treatment package is what's going to be allowing you to get past that plateau, to make more money and get paid based off of outcomes, off of your results, and off of the patient experience. So this is the number one reason why I offer treatment packages, because it will allow me to get past that plateau Otherwise, I'm just going to go back to the same old stuff. Only seeing X amount of patients a day, getting paid X amount of dollars per hour, and you're going to be capped, and you'll stay at that cap or below. But if you want to grow and overcome that plateau, you can create treatment packages where your strategies and your outcomes will allow you to overcome that plateau. And this is where I challenge a lot of physical therapists to think outside the box, get outside your comfort zone, learn how to ask for money, learn how to sell your product, learn how to attract the complex patient. So think about that. I challenge you guys to think about it. Let me know if you have any questions. Again, rich or successful people will choose to get paid based on results. Poor or unsuccessful people choose to get paid based on time. So think about that. Let me know if you have any questions, and let me know if I can help. Again, it's Ron Miller with cashbasedphysiotherapy.org. Thank you for your time, and until next time.